Hi, my name is Todd Sullivan. I'm a chiropractor in Burke, Virginia. We're just outside of Washington, D.C. area. In this video, I want to show you 3 ways that chiropractors can use dry needling in their practice. So I've been in practice for 16 years, and I've been doing dry needling for about 7 years now. I've also certified in ART and Graston and lots of other soft tissue techniques. But what really interests me with dry needling is the faster recovery that we get with patients. I often find that we can treat other areas more effectively, say for example the glute region, where it's a really thick muscle, or the quadricep, or it's a deep area you want to treat. Dry needling works really well for those areas that are tricky to treat, or if we're dealing with chronic areas, say like the trapezius or levator scap or rhomboid area, we find that that works really well at treating those areas. I'm going to show you 3 different ways that I use dry needling in my practice. The first way chiropractors can utilize dry needling in their practice is to treat trigger points or myofascial release. So what we're going to do in this case is we're going to treat her quadricep, and we're going to palpate into the different portions there and feel where she has any knots or tenderness. And then basically what we're going to do is we're just going to insert that needle right into that muscle to cause a twitch response. And that just feels like a little twitch for the patient. Often it replicates the patient's pain. It'll be like a dull, achy sensation. But it's a really quick, really effective treatment to releasing those trigger points. And again, why I would choose this over active release or Graston is probably the depth of the issue. So if we're talking really deep, this is going to be more effective, I find, compared to active release or Graston. A lot of times I'll do a combination of all 3 of them, but mainly I find that dry needling works really well for those deeper structures. So what we're going to do is we're going to just palpate for an area on her. In most runners, that vastus lateralis is really tight. I've taken 3 different dry needling courses, and they all have a different kind of take on it. Some are just kind of, you want to put the needle in and let that do its thing. Or the next thing you can do is you can actually piston the needle back and forth, and that's a little bit more uncomfortable for the patient, but you often get more of a twitch response when you put the needle in that way. If you have 2 needles in, you can apply electric stim to the needle, and that's another way to artificially get the muscle to twitch and relax. So I'm going to show you what that looks like in the quadricep. That's a little bit more comfortable for the patient versus just pistoning back and forth into the muscle. So now we have 2 needles into her quadriceps. So what we're going to do is we're going to show you what the stimulation looks like. So we're going to apply one portion of the stim unit onto the other needle and one on the other. And what we're going to do is we're going to turn it up until we get a light contraction. There you go. So the muscle's twitching right there. And again, it's like an artificial twitch response there, and can just help to relax the muscle a little bit deeper. And just depends on the tone of the muscle. If someone's very hypertonic, a lot of times I will do this just to cause it to relax a little bit more. Or if the patient doesn't like the pistoning action, I'll often use the stim machine to do that as well. And you could do that for 10 to 15 seconds and then take it off. And then if you had other areas, you could treat those areas with a stim. The interesting thing with dry needling is also when you're applying the stim, for example, if you're treating the lower leg and you're treating a certain muscle down there like a flexor group, you can often, when you're doing the stim, you can actually see the toes moving, and that's another way to confirm you're in the right location as well, besides a palpation, of course. But that's an interesting way to also get that kind of release of that tissue, and you can actually see those muscles moving, and you can really concentrate wherever you need the treatment at. The second way chiropractors can use dry needling in their practice is to treat radiculopathies. So what we do in our office is if someone has, say, some kind of radiculopathy, we will place needles in that segment level where they're having their issue, and then we'll also apply needles to the area in their extremity that correlates with that segmental level. And so then once we have those needles in those different areas, then we'll hook up a stim machine to those needles and kind of create a circuit between that whole pathway. So again, what it's going to do, it's going to help to decrease tone in those different areas, and then it's also going to help to kind of reset that firing pattern in that area. So we like to use that in this region a lot. So I'm going to show you what that's going to look like with the stim ad. And the nice part is, in this case, I have 3 different attachments. So we can start in the low back if we want to do hamstrings or gastroc or soleus. We can place those in there and then just kind of fire all those different muscles along that pathway, and we find it just speeds up that recovery for the radiculopathy. Same thing applies for the upper extremities. We can do the segmental level up there and then also treat the the muscles that it supplies down to the arm. And now we have needles in her lower back at her L5S1. Then we have them placed in her hamstring and then also in her gastroc and soleus. So what we're going to do is now we're going to hook up stimulation leads to those different needles, and then we're going to turn that on, and again we're going to get some light contraction in all that different pathway, and it can decrease the tone along that whole pathway. So now we have all the leads connected to the needles in our lower back. So now what we're going to do is we're going to turn on the stim machine, and we're going to create a little bit of muscle contraction in all three regions. So let me know when you first feel that little buzz or tingle.
Okay.
Okay. So what's great about this area is we can get into the multifidi muscle and really, again, kind of help to activate that muscle, because remember, with disc and radiculopathy issues, those muscles often decrease in size and decrease in function, so this is a great way to activate them. The next one we're going to go down to is the hamstring here. So again, let me know when you first feel that buzz or tingle. Good. Okay, you can see that muscle contracting right there. The multifidi muscles, a lot of times, are tougher to obviously see unless you're going through the erectors, which are really tight, and then you'll see a little bit of a contraction. Now, same thing for the gastroc here. We're going to go down there. Let me know when you feel it.
Yep, I feel it.
There it is. And again, so what we'll do, a lot of times I'll leave patients with this treatment on for 10 to 15 minutes, come back in, and that'll help to relax things. Now, obviously, this doesn't replace all your other chiropractic, laser, decompression, whatever, flexion, distraction. Those are all great techniques. This is just one way that I found can help accelerate that healing process for radiculopathies. The third way chiropractors can utilize dry needling in their practice is for conditions where you can't necessarily put the muscle or the joint through a range of motion. So think of like a frozen shoulder, adhesive capsulitis. Also, we do a lot in our office with post-surgical hip replacements, especially if they go from a posterior angle. Obviously, they cut through the glutes, and a lot of times once they get that hip replaced, that glute muscle's not firing as well as it should, and it's not activating like we want it to. So, for example, we'll treat that, and then we'll apply some stim to the needles, and that will activate that muscle and help to normalize that muscle function over time. So what I'm going to demonstrate right now is we'll demonstrate what it looks like in the glute medius minimus and glute max here. So, and then we'll apply some stim to it. The nice thing with dry needling, again, whether you're treating a post-surgical hip or whether you're treating just a common glute SI joint issue, you can use a needle length to get to where your problem is. A lot of times I will use a 4-inch needle when we're treating the glute area. It sounds crazy that you're using a 4-inch needle or longer, but a lot of those issues can be very deep in the tissue, and you just can't get there with your hands. Even with ART, you're pushing as deep as you can go. Some of our athletes, you cannot get to that depth that you need to, and the dry needling really helps us get to that with less discomfort for the patient too. They don't feel the difference between 1-inch needle or a 4-inch needle. It's roughly around the same thickness of a needle, but again, it just depends on where the injury is. And so it may be more superficial, it may be more deep, and then you can kind of target that. So again, we're gonna just feel a couple areas on her. What's really interesting with dry needling is you feel the injured area. So what I mean by that is you're going down, you don't really feel a whole lot of resistance, and then you'll get to that tightness in that muscle, and then you get kind of hit like a little wall. And then what'll happen is as that muscle releases or you get that twitch, it'll relax, and then you can insert even deeper. Say from a post-surgical standpoint though, they did a posterior approach and they cut through the glute muscle, so now we're going to apply some stimulation to the needles. And again, what we're looking for is just a kind of steady contraction. So it'll be bump, bump, bump. Where a lot of times what I've seen when the muscle's not activating correctly, it'll be really random. So it'll be like bump, bump, and then it won't twitch again, and then it'll restart again, or it'll be really, the rhythm pattern will be way off with these cases. And then again, what'll happen is as we treat it and as we loosen that tissue up and get it functioning correctly, you'll start to see it normalize as far as the pattern goes of the stimulation. And obviously certain areas, they're larger, more powerful muscles, you're going to get a larger contraction, whereas smaller spinal muscles, you're not going to get that same reaction, but you still will get the same effect. And that's how I use dry needling to treat a post-surgical hip or any kind of hip condition. The other condition I really think chiropractors could utilize dry needling for is with frozen shoulders. So again, we know how difficult these are often to treat, but what we find is dry needling works really well. We'll also combine that with laser therapy and Grafton. But for this, to get down to the deep capsular level, dry needling is highly effective for it. Again, you can target specific rotator cuff muscles or the different capsule, the deltoid, or even the trap with this. And so I'm going to show you how we would apply it for the capsule. So again, just palpating, feel where the tightness is. Go through deltoid, get down to that capsule level. From a posterior standpoint, and then again, what we'll treat a lot of times is all the rotator cuff muscles, infraspinatus, supraspinatus. We'll treat the trapezius because that'll get often overworked. And then obviously like deltoid, and then we'll hit the anterior side as well. But we find this is a great way to relax those deeper areas without having to add some active motion in. Once we can get those muscles to relax more, then we feel like we can do more ART or other soft tissue techniques, adjustments wise even, to free up that area. And a lot of times, like I said, just like I did with the hip, we'll apply stimulation of those needles, get the muscles to fire and contract, and that's another way to help decrease the tone and help to get the joint and muscle functioning better. So that's another great use for dry needling in your practice. So those are 3 ways that I think chiropractors can utilize dry needling in their practice. Now, I also do acupuncture as well. I was finding I was getting such great results with dry needling that I went and took a couple different acupuncture programs as well. But there is definitely a big difference between acupuncture and dry needling. Dry needling is a treatment modality for these tight muscles that we want to release, or, like I illustrated today, whereas acupuncture is a whole healing system, right? So that's not the same as this. We are using the same needles to some extent. So it's a completely different treatment and different intent with the needle, right? We're trying to release soft tissue with the dry needling, whereas acupuncture, we're trying to stimulate acupuncture points to help the patient heal. So I hope that illustrates just 3 ways that you can utilize dry needling in your practice.